time to raise the profile of this particular disease that, according to ovarian cancer research, is taking the lives of approximately 140,000 women per year internationally, okay? And so this is definitely a timely conversation. We continue this type of discussions that are affecting women across the month of May, and here to at least dissect this particular conversation with us is the CEO and the Chief Pathologist at Pathcare, Dr. Kiran Radia. Welcome to the show.
Thank you, Shiko.
Karibu sana.
A pleasure to be here.
Pleasure to be here. I just love Dr. Kiran's reaction about being on TV. And she's like, oh, is that me? Yes, it's all you. Welcome. So I'm assuming this is first live interview you've done, or have you?
Yes, I've done a few before.
Yeah. But every time
like I said, Shiko, this is not my scene.
Yeah.
But I do like to share knowledge, and I think, yes, we need to spread awareness. We really do. And when I talk to women and how they neglect themselves, I get very worried.
You get very worried. And it's interesting because for you, coming from a lab setting, you're very, very proactive on doing the outreach work of it. Like, you would think you're also, you know, dealing one-on-one with the patients themselves, like a general practitioner. Why the love for advocacy?
I think every medical personnel feels that we must be patient-oriented, we must close to them, we must understand what they really want. So my job is actually diagnosing that cancer. And let me tell you, Shiko, ovarian cancer is what we call one of the hidden cancers. By the time we pick up in the women, it can be stage 4. That means it has already spread. And why that happens? Because we just are not regular in knowing the cancer. There is so much campaign on cervical cancer. You know, in our country, cervical cancer is one of the leading cancers of Kenya. So hence we really concentrate, and it's preventable, we feel, as doctors, you know, with a vaccine and with early detection. So, I mean, simple pap smear will detect early cervical cancer. Similarly with ovarian cancer, it grows, and the patient will feel a few symptoms. Sometimes, let me tell you, a lot of women will come and say, I got abdominal, I got digestion, I got, you know, very vague symptoms, not knowing that it is related to the ovary. And now, you know, bloating, fullness feeling has been sort of alerted that if you feel like that, please go and get a checkup done.
So when we actually try to look at it on the scale, you know, against other cancers, what can you really tell us? Because when we look at ovarian cancer, also considered leading cause of cancer death, but help us paint a perspective for us on where we are on ovarian cancer.
So ovarian cancer can affect any age. We can diagnose it in the young girls. There are different types. Let me start by saying, I was told don't keep it too medical. But
yes, please.
But there are different types of cancers in the ovary. I'm only going to talk, when we talk about cancer, there can be lumps which are benign and which are picked up. Benign means they will not spread. You go in and remove the ovary and the patient is okay. But the cancer means that this has a potential to spread in the rest of your body. So we see cancers in the young girls also, 20s, we can see it in the later on. Different types, but the ones that's common are in the older group. And Shiko, I've seen them in the 40s. No, it's by the time, because it's just a growth. It keeps on growing in you. You don't realize how many times do we feel over ovaries. Hardly ever. If you have a lump in the breast, you'll feel it. But in the ovary, you don't. You just get the bloating, you just get a feeling of fullness and pain in the pelvis. And let's be honest, how many of us will go to a gynecologist or obstetrician only when we are having babies.
Yeah, I know, right? and this is the thing, because you've highlighted what even I wanted to bring up next. And this is from what I just came across literally while reading more about ovarian cancer. It's that it's actually believed that very many women don't want to make a fuss, in quotes, because of what you're just saying. You're like, I'm not going to go see the doctor because I have abdominal pain. Like, for what? You know?
Absolutely, absolutely. And they'll have their Panadols. And I know one person who changed her whole diet. Can you imagine? Because she thought it was related to her diet.
Oh, geez.
And then some of them will lose weight. Some of them start having distension of the abdomen, which is not a good sign.
Yeah.
That's when it's spreading. But they will ignore it. Oh, I put on a little bit of weight, you know.
Yeah.
But I'm not feeling well. I don't understand.
But clearly the pain is not that severe if you're not feeling that you have to go see a specialist.
No, it's on and off in the beginning. And you don't feel the mass. It's growing slowly.
Okay.
But then comes a time when it can become quite large and you can feel it. So what do we say? Many women ask me, how can I know it's an early ovarian cancer?
Yeah.
And they always want me to do a blood test. Now we have a blood test called CA125 for the ovarian. But do you know that it is positive only up to 40% of the cancers? So I tell the women in my wellness, we offer wellness programs. Just to pick up, the whole idea is pick up prevention, you know, pick up the cancers early, where we can deal with them. But many women say, oh, I want to do this marker. It is not. It does not exclude cancer. I want to tell that to every woman. CA125 does not rule it. Don't think just because you've done it and it's negative, you don't have a cancer. What really picks up ovarian cancer in the early is regular visits to your gynecologist.
That's the trick.
And then we do ultrasonography. Many women have asked me, you know, when I go to talk about the wellness, because I become a great believer of wellness program, and we offer it quite extensively, because I really have seen the effect of early detection and then prevention of spreading the cancer. So ultrasound is the main thing. It's a radiological, simple test, not related to radiation. Go and get an ultrasonography. Go and see your gynecologist. The gynecologist need to do what we say, the bimanual examination, you know, of the sides of the uteruses. They looked at the uterus, they feel the ovaries, and they can pick up the enlarging ovary very quickly. So my message to all the women is that please get a regular checkup done. It is not a blood check, but do. When you're not feeling well, go to your doctor. And gynecologists, and you know, we've been regularly told that you must go to your gynecologist at least once a year, and if you can't manage, at least once in 2 years.
Absolutely, very, very important. So two things here that I actually just want to bring up. You know, we have this kind of conversation, this campaign, every time we're talking about cancers, about early detection. So that message is well and clear. The question is, what's stopping us, those of us who are even as exposed, you know, to this messaging of early detection saves lives? So what are the reasons why people don't actually go for screenings? Is it a cost factor, Daktari? I mean, what's your assessment of it? Why do women just
You know, it's not the cost factor alone, let me tell you, Shiko, I get shocked. We were having a campaign on cervical cancer. You know, last month, we did a lot of cervical cancer. And when we pick up the abnormal cells, I was shocked. A couple of women told me on the phone when I'm talking to them that we found this abnormality. Oh my God, I wish I'd never done it.
And in fact,
that was a reaction. The
fear of knowing.
The fear of knowing. And my God, I wanted to tell them, but we picked it up. You're not going to have cancer, it's spreading now. It's early detection. We can do something about it. But that was the first reaction, and it really shocked me. The fear, I think, of something happening.
You'd rather just not know.
Not know. Which is not a right thing. Because remember, any cancer, early detection will be curative in most of the cases. So, when even in ovarian cancer, when we look at it, the doctor will, the surgeon usually, the gynecologist will submit the ovary, which is enlarged. We cut it and then we look at, we diagnose in path care. So, when we look at the capsule, the most important thing in stage 1 is to make sure it hasn't gone beyond the capsule. So, we look at it very carefully, what we call stage it, then the doctor knows what to do. And voila, you know, it's gone. You picked it up very early. You don't have to worry. And then the women who are in fear, whatever reason, or because they're so busy, you know,
you just keep
they rather look after the husbands and the children than themselves. They, by the time they present, it's stage 4. It has spread everywhere. It is very sad. I've seen 40 women in their 40s, you know. Why? Oh, I felt a bit of discomfort. I thought it was just acidity. And it has gone to stage 4. Then it's bad. No? You need chemotherapy, you need radiotherapy, and it's quite an extensive disease, ovarian cancer.
I don't think we would have even put it, you know, better than that, Dr. And I think for the women who are watching, this is a clarion call to just put your health at the forefront and those checkups. Because when you say something like people are telling you, I had no idea. And what do you do when it's stage 4? I mean, literally, what do you do when it's stage 4? You know,
true.
And
if you've seen some
limited.
And if you know you know some of your friends who are going through it, it's not easy. When it's stage 4, you have chemotherapies, we have management, we have you know, the chemotherapies are becoming better. We have what we call target, but it is not easy. So my message to everyone is get yourself checked regularly. Any symptom you have, don't take it down as acidity, lightly. If it's persistent, you feel the bloating effect, you feel the on and off pain in the pelvis. Oh, I had a sudden pain. Once in a while, I can admit it's because of the twist or something. But if it's persistent, have it looked at.
Have it looked at.
No, have it looked at. It's not a, like I told you, I want to repeat that, Shiko. Women will come and tell me, can't you do a simple blood test? I don't want to go to the gynecologist, I'm not comfortable. Or then I said, go and get the ultrasound done. Ultrasound is, the pelvic ultrasound is the gold standard to early detection. So, and you know, like I repeat, there's no radiation, it's safe, get it done regularly, and make sure there's no lump.
And I'm glad that you've brought that up as a myth buster, because there's always the perception about doing the screening and people assuming, or women assuming, that it's an extremely excruciating, painful experience. Even the fact that you have to go see your gyna, there's always that fear that, oh, it's too painful. And I like the fact that you're saying it's pain-free, ladies. It's pain-free. It's pain-free. Okay, let's talk about you know, the screening that's actually done for when we talk about cervical cancer, that is, right, Dr. And there's the perception, by the way, that the cervical check screening program checks all cancers.
I'm so shocked.
So why don't you demystify that for us and break it down? Discuss the emphasis why it's important to understand that going for a cervical check screening is not going to be detecting all the cancers
in the female genital system.
In the gynecology.
Okay, you know, cervical smears are only related to the cervix. And in the olden women, if they're bleeding abnormally after menopause, we might pick up if it's an endometrial carcinoma. Maybe that's where it's come from. In an older woman, when she's having what we call post-menopausal bleeding, we can pick up cancer cells of the endometrium from a cervical smear. We can suggest it, and of course the definite thing is the curettage, but not ovary. Ovarian cancer cannot come down now into the cervix. They are separate organs on both sides of the uterus, and it's very different. Endometrial maybe, but not ovarian. Ovarian cancer, and I think you got to know, the women have to know if who are the women who should be more vigilant? I think it's coming ad hoc in women, but there is some genetic predisposition. We found out, it has been found during research, Shiko, that women who have got breast cancer because of genetic predisposition have got a high risk of ovarian cancer at the same time. So, if you have a family history of breast cancers, please get your ovaries checked regularly, because that gene can express in breast and in the ovaries.
Oh, wow.
Many people don't know that.
Right.
So, be careful if you